I'm Haley Fuller.
I'm Adam Fuller.
And I'm Angela Sisney. And we're nurses from the Murray State RN BSN program.
All right.
Okay. We're just going to do a presentation on new medication education for all post-heart cath stent patients. The purpose of this project is this was a process improvement that they were already working on in the unit, and we wanted to promote education and awareness on this area of specific post-heart cath patient. Our problem statement: in order to continue to deliver excellent patient care, Baptist Health needs to provide accurate and understandable education regarding discharge medications for the post-heart cath patient. A recent short study conducted at Baptist Health Madisonville shows that only 66% of patients discharged post-heart cath are being educated regarding their medications. According to national research conducted by the American Heart Association, 25% of those patients are compliant with purchasing and taking their prescribed medications. Also, according to the same study, patients only took medications they felt provided a beneficial effect. Clearly, this is needed an area of understandable education to provide the best outcome for our patients. This education must also be documented. If Baptist Health does not deliver education with documentation, this could lead to patient noncompliance, leading to poor outcomes for the patient, readmission with possible further complications, and lack of hospital reimbursement. Our group's goal is to improve documentation in medication of the post-heart cath population by providing evidence of the need for improvement. Why documenting post-heart cath medication is important. A study found that when a patient is in the hospital for coronary angioplasty, the speed of events actually mismatch between the expectations and the reality affect their emotional state, influenced by the understanding of the primary angioplasty process. Mostly this is because of the sense of being cured. When the acute symptoms resolve, our patients tend to feel that they no longer have a long-term condition due to that temporary relief. We must ensure that the patient understands heart disease and complications are not just temporary events, but occur from a lifestyle that needs continued change. This is done during our post-heart cath education on why these medications must be continued. In 2009, the Department of Cardiology found aspirin resistance is a rare in compliant patients using methods that directly indicate the degree of platelet inhibition. More than 10% of patients receiving aspirin for coronary stenting are non-compliant for aspirin therapy during that first month after stenting. These results suggest a need for improved education in these patients. To ensure we have done all we can in providing the patient with the knowledge, we must document all our educating efforts.
If you guys have any questions or comments as we go, feel free to jump in.
This is just a did you know. According to the American Academy of Family Physicians, approximately 40% of patients treated with the balloon angioplasty develop this restenosis. This was reduced to roughly 30% with the use of the bare metal stent. Restenosis within the stent can occur, and it is difficult to treat. Those drug-eluting stents that we have lower those rates and percentages of restenosis, which is about roughly 10%. The study justifies the importance of taking antiplatelet therapy regardless of bare metal stent or drug-eluting stent. That's why it's so important to educate these patients. The study confirmed that concerns about MI and death with drug-eluting stents were related to early disruption of Plavix or antiplatelet therapy. Also, the Journal of Pharmacy Technology found 20% incidence of no adherence to Plavix therapy. Concluding from that study, the shorter duration of therapy resulted in an increase of likelihood of compliance. So pretty much if the doctor says take it for a less amount of time, they're more likely to do that than these patients that have a year. They're not going to want to take it as likely. This finding is a concern due to the recommendations to prolong antiplatelet therapy to at least 1 year following coronary intervention with a drug-eluting stent. This justifies the need for our focus on post-heart cath patient education and its importance for these patients to continue to take their medications and reduce the risk of recurring hospitalizations or worse, death. Some reasons for our non-compliance in these patients is, first off, when they come in, they're overwhelmed with their diagnosis anyways. So they have all that and the anxiety of that on top of their reason for illness. So we need to continuously educate from admission to discharge. And then secondly, forgetfulness, because they need some type of support system involved, like a friend, family, somebody to be able to come in there every day to remind them if they need that. And thirdly, affordability. Some programs that we have are the Stamp Plus program that offers financial assistance, and then here in Kentucky we have the Kentucky Transitional Assistance Program, cath, through like the Salvation Army. These patients, we need to be educating them that they can get, if they don't have insurance, all they need is a doctor's note, and it takes up to 30 days to get that, but they can get their medication provided for free. They just need to get the doctor's note, and that's all they need.
In Baptist Health System, provision of patient care needs. In the scope of practice is all patients discharged from Baptist Health Madisonville are the responsible party for the continuing of care needs of the patient are provided with the education to enhance their knowledge, skills, and behaviors necessary to fulfill the benefit from the healthcare interventions provided by the hospital. And the policy is upon entry into the Baptist Health Madisonville healthcare system and throughout the hospitalization, the patient, family, or a significant other educational needs are assessed by the RN or other professional disciplines, admitting the patient for services and developing a multiple disciplinary plan of care. And a study interviewed patients at a large hospital the morning of discharge and found only 50% of patients could name at least one of their medications. There was a lack of written information given to the patients, and that was from a study. And ways to educate is to make a plan with the patient, agree on realistic learning objectives, find your patient's education style to improve compliance. An example is one-to-one education. They have YouTube, drawings, pamphlets, teaching, podcasts, posters, and charts. And individualized education begins with assessment of the needs, planning, and diagnosing. Education begins at time of admission, and the article references those patients who are provided knowledge about their disease process up to the more favorable outcomes. And who educates our patients? Physicians, nurse practitioners, nurses, physical therapists, occupational therapists, speech therapists, dietitians, and just health educators in general. And some of the barriers that were found while researching was time, inadequate staffing, lack of management support, the understanding of medications, and unavailability of teaching resources also are barriers. And the nurse's role is important in providing medication education because we spend more time with the patient. So that's one really big opportunity that we have to educate our patients, because we do provide the majority of the care. And usually the nurses are the ones that start the medication and give the medication while the patient is in the hospital. And we usually build up a rapport with the patient and with their family members, so that helps also. And we can assess the knowledge deficits in order to get the appropriate education materials to the patient and their families. And how can we alleviate some of these barriers? We can provide medication education when we give that first dose of medication, and we can give them medication information sheets, and there are pre-printed simplified education leaflets can be obtained and given to the patients to where they can understand the medications, and maybe have an incentive for employees.
Okay. This is a graph showing the percentage.
Yeah.
She get kicked out of that when she started waving.
This is a graph of percentages that you guys actually already had from April 2013 to September that your unit-based council and Gloria have been collecting. This was based off of your all's purple sheets that you put in your chart and also the barcode label book that you keep at the desk. You can see there's quite a bit of fluctuation. I think your all's goal was 90% to show that there was some sort of documentation of that patient being educated in the paper, purple paper being signed. So that's kind of where we came up with our objective. And our objective was to make an education piece providing necessary information for staff administering care to the heart cath patient. And this piece was also to act as a brochure for the patient to take home and reference. And we have one of those there if you guys want to look at that. We called it just Heart Cath Stents in You. Kind of goes through just a quick run through of what the patient will experience that day before, during, and after their procedure. And some follow-up things to talk about with their doctor or nurse if they do have a stent placed. And you guys are welcome to use that if you want to. It shows a picture there of the stent and the placement of it and plaque and what can happen if you don't take your medication as prescribed, and just some pretty quick layman terms, things that the patient can quickly read or the nurse can reference pretty easily just to give a gist to the patient if they're having some trouble understanding what's going on. We also wanted to do a computer-generated report that showed the percentage of education documented to post-heart cath patients. We tried to work that out with IS. We wanted to do that every 4 weeks. We wanted to make a data set that would promote like a non-punitive sense of accountability to the unit. Kind of like we do with the medication sheets. We're going to print out one that showed the particular new medication that had been ordered, and then the education that had been documented about that medication, but they weren't actually able to do a specific chart set for that. So unfortunately we'd still have to go through the chart and kind of do the paper trail follow-up like you have been doing with your purple sheets. But that was one initiative we chased with, what's her name, Sherry?
Sherry Gish
Sherry
and Kate
Gish
Fuller.
and Kate Fuller, but we weren't able to actually do that. But if they had been able to look at some sort of percentage on the bulletin board, it could just be a friendly reminder, don't forget to document your education. Or an email could have been sent out or whatnot if we could have had those reports printed. You could still, I guess, do that intervention, based off the purple sheets if you wanted to follow that.
Like they flagged for the propofol.
Yeah.
When you got that note on your locker, your body was attuned to that.
I hated my mom.
Yeah.
But they scanned her propofol.
But they sure
I was going to
did.
say,
Yes.
Haley said you guys have
Yes,
had
that
awesome
worked very
improvements
well.
after those
We
notes
did.
started.
We improved greatly on that one.
Yes.
And then just for the purpose of this project, we were to have key staff members of your all's facility to remain in place after this project, and that would be Missy Tittle since she's head of unit-based council. And then Sarah Guthrie also said, and then Christy Payne, that they would continue to call people if you guys wanted to follow up on those other interventions that we're fixing to talk about. As far as project planning and implementation for the purpose of this, I'm going to have to use this slide because I can't read that for let's see. Gloria here, we outlined the need for improvement in education documentation. We discussed with her our own ideas to promote education compliance. Angela, myself, and Haley researched the importance of education and documentation for the post-heart cath group. During our research, we did contact Kathy Dollahan at the education department. We also contacted Kate Fuller and Sherry Gish and tried to incorporate some other departments to work on this project to sort of boost compliance with documentation of education. We did keep Sherry Richardson and Gloria Capps, the assistant director of critical care, kind of up to speed on the survey questions we developed that we would ask the random heart cath patients. And I'll show you guys that on the next slide. We also asked key staff members of the unit-based council, such as Missy Tittle, like I said, and then Crystal Payne and Sarah Guthrie, to remain on the project. And then we did develop the brochure that we showed you guys, as far as, you know, just kind of boosting awareness of the need for documentation of the education. And actually on the graph, it showed good things. Based upon our random calls, we did just a quick survey. It was 3 quick questions. One to sort of reference the patient's stay and them having a heart cath and a stenting. We asked the patient, did your nurse provide you with education about your medication? Did they provide you with information, you know, necessary if you weren't able to purchase your medications? And then did they talk to you about the importance of your medication? We selected 12 random patients over the course of the last 7 months so that we could get a time frame from your all's information and then our data as well. Out of the 12 patients, we were able to successfully call and speak to 7. 7 out of 7 every time said that you all did absolutely provide medication on the new medications regarding stent and blood thinners. And then 7 out of 7 absolutely said that you guys talked to them about the importance of their medication. So the fact of it is, it's just we're not having time or forgetting to document. So I mean that's a good thing that came out of that survey. So you guys are doing it. It's just that, you know, it's not being documented. And
For these patients, we actually did, everybody, it was 100% documented though, that Gloria, we checked and made sure that they were, but we always need to, we are always doing education continuously, we just don't always document all those times.
Let's see, and then as far as project efforts, let's see, and kind of restating what Haley just said, as nurses we educate constantly, but we don't always provide proof of our education through documentation. And you know the other saying, if it's not documented, then it wasn't done. Well, like I said, according to our research, it does show that you guys are providing that education. We just need to make sure we document it. Alright, in conclusion, it's believed that patients who receive medication education better adhere to their medication regimen. Nurses have a vital role in patient education. Many authorities agree that nurses should play a major role in the education of the patient, and that teaching patients is a very important component of our care. The reason behind this plain of thought is that the nurse, you know, has an increased opportunity, kind of like Angela was talking about earlier. We're always with our patients. We're always talking to them, so we should always be incorporating new information to them, or reviewing, you know, old information with them, making sure that it really stays concrete before they go home. Because they are overwhelmed while they're here, and they're not going to remember everything that we say. So the most important things, if we can highlight that each time we're in the patient room, and then above all, make sure we document that, and that covers our end and theirs as well. And then in providing constant care, the nurse is in better position to assess the patient's educational needs and willingness to learn. And that's especially true of the post-heart cath patient as well. Through the process of collecting data and in talking to different nurses about being involved in the collecting of data, we feel that we did raise some awareness about the importance of documenting your education, and awareness of reducing poor outcomes for the patient, readmission with possible further complications, and lack of hospital reimbursement. We hope to have a survey tool left behind for future survey and data collection measures. And, oh no, you're finished. Sorry.
You have to go around that way. I'll go around.
And then you guys, like I said, are going to keep up with those questions and polling to continue that sort of study as you go. And then we hope to see an increase in the percentage of the following months to meet the unit goal of 90%. and you know, maybe reconsider the idea of if there are repeat offenders of not, you know, always documenting your education. There might be some sort of, hopefully not disciplinary, but if you got to that, you know, some sort of system of accountability. That way, if they can remember to document. We learned that our nurses at Baptist Health are doing a great job of educating their patients. It's just that they need to be more prudent in their documentation, which I think is a good thing. You guys are doing what you're supposed to be. It's just we're busy. We forget. And then that's our reference slide if you guys want to look at that.
Yes. Thank you for your help and everybody that helped with this project.
Any questions, anybody?
Comments,
Questions?
tomatoes to throw, or
I like the idea of the survey. I hope that can be followed up on. And it's also, I think it just, you know, anytime you can call somebody after they've been on your unit for a little bit and ask them, that gives them opportunity, other ways to improve. But medication is such a big thing, and people take so much of it. And, I wish everybody was like my dad. He was just in the hospital, you know, a couple of weeks ago. And every time, you know, you bring in this little pill cup and go, it doesn't matter, you're going over it, she stands there, she opens up the packages in front of him and tells him, and he still looks at it in the cup, and he's like, now what is, you know, and so he's really interested in what he gets. Not all people are maybe that, you know, that interested in it, but they, I think, you know, I think everybody does a good job educating on my job. I think we just lack sometimes the opportunity to get it documented on there.
well, and that's kind of what we were talking about with Sherry and Kate. If you know, it was easier to, you know, show that we documented. So maybe we can follow up with them or something on a different project or something.
Because
How you
they
make
said
that easier to see.
tool is too specific, like, you know how you have your option now since all this process improvement of the medication tab just right there when you have medicines, but I was wondering like if maybe a prompt on those specific medications would come up, and you know if a stat emergent you can override like normal, but that's so specific they can't filter that for just heart cath medications, you know, so or if it's new. So it's too specific for their
I think what she said, pharmacy would have to be involved. It would have to go through like Margo and NPQC
detect it, so
to even get something like that.
So the
You thought that would be cool for you guys to post though. I mean, that way you can see that you are doing
the drug assistant. What
Yes.
now? How is that something that can be? Is that to cover like months and months of it?
yes, you can get KTAP I think up to 24 and longer months, right?
It's a pretty
Yeah,
it's a lengthy program. It's 18 to 24 months.
18 to 20, yeah, 18.
Like based upon your need and then of the availability of the.
The important with KTAP, they said that when I called, she said it's just so important because like these people with not having any type of insurance, they said 30 days it can take. So they said they can try to promote, like fund half of it, and maybe if they can come up with half, but some people are going to say, I don't even have half, you know, so that's where like get case management involved early, and just do the best you can because you don't want them 30 days is too late. They've already, you know, they've done the damage with the stenosis there. So they said it can take up to 30 days. All they need is to be uninsured and have a doctor's note, and then they'll get that for them. So it'll fund it up to 18 to 24 months.
Didn't you look into the Walmart $4 plan thing or something?
They actually said the off-brand of Plavix was $8.92, and then the statins were $9.92 for the cholesterol medication.
That's for a month
30
supply.
days supply.
That's
Yeah. Did you have it?
That's what I think the numbers are on the screen.
And then all their others, like the basic, like aspirin, they you know they can get that, and then they have the $4 plans at Walmart.
A lot of it's just, you know, pre-planning with your patient. It's stuff that, you know, if you look at it ahead of time, like she was saying the 30-day thing, that way we have time to get their paperwork done.
Paperwork and samples. Those 30 days, if they can just get samples.
Samples
For the voucher cards, like that.
Exactly. Yeah. So as long as they can get something for those 30 days until it comes through.
I know sometimes we think it's like one more thing to do, but it's a whole lot more to do to take care of somebody that's had a fault out, you know, or that it comes back in worse shape if they haven't
Exactly.
done what
And
they
once
need
they're
to
out
do when
of
they're home.
gone from the hospital, it's less to be worrying about it being. It's so late in the process. They've already missed a couple days.
Yeah, I know we've got a readmissions committee right now that Amy Smith does, and a lot of that. So I think their main focus right now is, of course, the CHF patients. We're trying to get them readmitted, but I mean, a lot of these with the heart attacks, they turn into the CHF patients if they took a big enough hit. So it's kind of be really. We start with these, and our long-term goal, I'd like to see us spread out to everybody to be sure that they have all that, some type of education if they start, but we just felt like the heart cath patients, or at least the, some that we get, that we almost feel like every one of those are going to be started on something new, unless they're a repeat person that was already on something, and then they have another one, so.
How long did you say you wanted to give that until you looked at another target group, maybe?
Well, we usually, I think we're thinking probably first of the year. So I don't know if our numbers are gonna allow us to move it up a whole lot, because that'll be something we'll have to kind of look at toward the end of the year. If the percentages maybe toward the end of this year is a little bit better the next couple of months, then maybe we can, kind of include other groups, but. It's definitely an ongoing process. We appreciate, though, your help on it and ideas and things. So it never hurts to have other people, looking at it from outside of where you're at. Sometimes you get so wrapped up in what you're doing right on the unit, you can't see it as clear as somebody that's looking in from the outside. So
we actually almost felt at a loss after that, because really, I mean, you guys are doing your part. It's just clicking it in.
Yeah,
you did do
it
your
is.
part.
And I'm not quite. I don't understand the whole process thing, because it's they developed that report, and I've asked Kate, and it's supposed to feed in from both places, and even when sometimes I've looked and people have documented under the education tab, and it didn't flow into my report. But it says that it's supposed to. It's set up to do that. So I'm not sure what that issue is with that. But by looking at it, when I was checking the data, I always looked both places, because I know sometimes people are just in that mind frame. That's a patient education tab, so you just go there to it. The other one was developed just to make it easier. So but as long as it's in there, one of those two places. As long as it's getting done, that's the main thing. As long as they're educating.
Well, thank you guys very much.
Thank y'all for getting to come back here.
Yeah, I appreciate you.
Yes, thank you guys.
We can keep this little stamp thing, right?
Yes, that's all yours.